Comprehensive NCLEX RN Practice Exam 9 2026. Question 1. Which roommate would be suitable for the 6-year-old male with a fractured femur in Russell's traction? A. 16-year-old female with scoliosis. B. 12-year-old male with a fractured femur. C. 10-year-old male with sarcoma. D. 6-year-old male with osteomyelitis. Room assignments in pediatrics should ideally match children of the same sex and similar age. The 12-year-old male is the most appropriate peer. Question 2. A client with osteoarthritis has a prescription for Celebrex, Selexib. Which instruction should be included in the discharge teaching? A. Take the medication with milk. B. Report chest pain. C. Remain upright after taking for 30 minutes. D. Allow 6 weeks for optimal effects. Celebrex is a COX-2 inhibitor linked to an increased risk of cardiovascular events. Patients must report chest pain or symptoms of a stroke/ME immediately. Question 3. A client with a fractured tibia has a plaster of Paris cast applied to immobilize the fracture. Which action by the nurse indicates an understanding of a plaster of Paris cast? The nurse: A. Handles the cast with the fingertips. B. Pedals the cast. C. Dries the cast with a hairdryer. D. Allows 24 hours before bearing weight. Plaster of Paris casts take 24 to 72 hours to dry completely. Weight bearing should be avoided until the cast is fully dry and hard. Question 4. The teenager with a fiberglass cast asks the nurse if it will be okay to allow his friends to autograph his cast. Which response would be? A. It will be alright for your friends to autograph the cast. B. Because the cast is made of plaster, autographing can weaken the cast. C. If they don't use chalk to autograph, it is okay. D. Autographing or writing on the cast in any form will harm the cast. Fiberglass casts are durable and water-resistant. Allowing friends to sign the cast with markers does not compromise the structural integrity. Question 5. The nurse is assigned to care for the client with a Steinmann pin. During pin care, she notes that the LPN uses sterile gloves and Q-tips to clean the pin. Which action should the nurse take at this time? A. Assisting the LPN with opening sterile packages and peroxide. B. Telling the LPN that clean gloves are allowed. C. Telling the LPN that the registered nurse should perform pin care. D. Asking the LPN to clean the weights and pulleys with peroxide. While sterile technique is used for initial insertion, clean technique with site-specific cleaning is often acceptable for established pin care in many protocols. Question 6. A child with scoliosis has a spica cast applied. Which action specific to the spica cast should be taken? A. Check the bowel sounds. B. Assess the blood pressure. C. Offer pain medication. D. Check for swelling. A body spica cast puts the patient at risk for cast syndrome, superior mesenteric artery syndrome. Monitoring bowel sounds is vital to detect intestinal obstruction. Question 7. The client with a cervical fracture is placed in traction. Which type of traction will be utilized at the time of discharge? A. Russell's traction. B. Buck's traction. C. Halo traction. D. Crutchfield tongue traction. Halo traction is a type of skeletal traction that allows the patient to be mobile and is used for long-term stabilization after discharge. Question 8. A client with a total knee replacement has a CPM, continuous passive motion device, applied during the postoperative period. Which statement made by the nurse indicates an understanding of the CPM machine? A. Use of the CPM will permit the client to ambulate during the therapy. B. The CPM machine controls should be positioned distal to the site. C. If the client complains of pain during the therapy, I will turn off the machine and call the doctor. D. Use of the CPM machine will alleviate the need for physical therapy after the client is discharged. The controls for the CPM machine should be kept away from the operative site, distal, so the patient or staff can adjust it without disturbing the wound. Question 9. A client with a fractured hip is being taught correct use of the walker. The nurse is aware that the correct use of the walker is achieved if the A. Palms rest lightly on the handles. B. Elbows are flexed 0 degrees. C. Client walks to the front of the walker. D. Client carries the walker. Proper walker height is achieved when the patient's palms rest on the hand grips with the elbows flexed at a 20 to 30 degree angle. Question 10. When assessing a laboring client, the nurse finds a prolapsed cord. The nurse should A. Attempt to replace the cord. B. Place the client on her left side. C. Elevate the client's hips. D. Cover the cord with a dry, sterile gauze. Elevating the hips, Trendelenburg or knee-chest position, uses gravity to shift the fetus off the cord, preserving fetal oxygenation until an emergency C-section is performed. Question 11. The client presents to the clinic with a serum cholesterol of 275 mg/dl and is placed on rosuvastatin, Crestor. Which instruction should be given to the client? A. Report muscle weakness to the physician. B. Allow 6 months for the drug to take effect. C. Take the medication with fruit juice. D. Ask the doctor to perform a complete blood count before starting the medication. Statins can cause rhabdomyolysis, muscle breakdown. Patients must report any unexplained muscle pain, tenderness, or weakness immediately. Question 12. The client is admitted to the hospital with hypertensive crises. Diazoxide, hyperstat, is ordered. During administration, the nurse should A. Utilize an infusion pump. B. Check the blood glucose level. C. Place the client in Trendelenburg position. D. Cover the solution with foil. Diazoxide can cause significant hyperglycemia by inhibiting insulin release. Blood glucose monitoring is essential during therapy. Question 13. The 6-month-old client with a ventral septal defect is receiving digitalis for regulation of his heart rate. Which finding should be reported to the doctor? A. Blood pressure of 126/80. B. Blood glucose of 110 mg/dl. C. Heart rate of 60 bpm. D. Respiratory rate of 30 per minute. A heart rate of 60 bpm is too low for an infant. Digoxin should be withheld and the provider notified if the infant's heart rate is below 90 to 110 bpm. Question 14. The client admitted with angina is given a prescription for nitroglycerin. The client should be instructed to A. Replenish his supply every 3 months. B. Take one every 15 minutes if pain occurs. C. Leave the medication in the brown bottle. D. Crush the medication and take with water. Nitroglycerin is light-sensitive and loses its potency if exposed to light. It must be kept in its original dark glass bottle. Question 15. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? A. Macaroni and cheese. B. Shrimp with rice. C. Turkey breast. D. Spaghetti. Turkey breast is a very lean protein and contains significantly less saturated fat compared to macaroni, cheese/dairy, or spaghetti, if served with meat/oil. Question 16. The client is admitted with right-sided congestive heart failure. In assessing the client for edema, the nurse should check the A. Feet. B. Neck. C. Hands. D. Sacrum. Right-sided heart failure causes systemic venous congestion, which typically manifests as dependent edema in the feet and ankles. Question 17. The nurse is checking the client's central venous pressure. The nurse should place the zero of the manometer at the A. Phlebostatic axis. B. PMI. C. Rerb's point. D. Tail of Spence. The phlebostatic axis, fourth intercostal space, mid-axillary line, corresponds to the level of the right atrium and is the correct reference point for CVP measurement. Question 18. The physician orders lisinopril, Zestril, and furosemide, Lasix, to be administered concomitantly to the client with hypertension. The nurse should A. Question the order. B. Administer the medications. C. Administer separately. D. Contact the pharmacy. ACE inhibitors, lisinopril, and diuretics, furosemide, are frequently used together for the management of hypertension and heart failure. Question 19. The method of evaluating the amount of peripheral edema is A. Weighing the client daily. B. Measuring the extremity. C. Measuring the intake and output. D. Checking for pitting. Measuring the circumference of the extremity with a tape measure provides an objective, consistent method to evaluate changes in peripheral edema. Question 20. A client with vaginal cancer is being treated with a radioactive vaginal implant. The client's husband asks the nurse if he can spend the night with his wife. The nurse should explain that A. The overnight stays by family members is against hospital policy. B. There is no need for him to stay because staffing is adequate. C. His wife will rest much better knowing that he is at home. D. Visitation is limited to 30 minutes when the implant is in place. To minimize radiation exposure, visitors are limited to 30 minutes per day and must maintain a safe distance from the patient. Question 21. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited to the client? A. Roast beef sandwich, potato chips, pickle spear, iced tea. B. Split pea soup, mashed potatoes, pudding, milk. C. Tomato soup, cheese toast, jello, coffee. D. Hamburger, baked beans, fruit cup, iced tea. Patients with facial weakness or dysphagia post-stroke require soft, easy-to-swallow foods to prevent aspiration. Question 22. The physician has prescribed Novolog insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the peak action of the insulin occurs? A. I will make sure I eat breakfast within 10 minutes of taking my insulin. B. I will need to carry candy or some form of sugar with me all the time. C. I will eat a snack around 3 o'clock each afternoon. D. I can save my dessert from supper for a bedtime snack. Novolog, insulin aspart, is a rapid-acting insulin. It has an onset of 15 minutes, so the patient must eat immediately after administration. Question 23. The nurse is teaching basic infant care to a group of first-time parents. The nurse should explain that a sponge bath is recommended for the first 2 weeks of life because A. New parents need time to learn how to hold the baby. B. The umbilical cord needs time to separate. C. Newborn skin is easily traumatized by washing. D. The chance of chilling the baby outweighs the benefits of bathing. Newborns should not be submerged in water until the umbilical cord stump has fallen off and the area is completely healed to prevent infection. Question 24. A client with leukemia is receiving trimethotrexate. After reviewing the client's chart, the physician orders leucovorin calcium. The rationale for administering leucovorin calcium to a client receiving trimethotrexate is to A. Treat iron deficiency anemia caused by chemotherapeutic agents. B. Create a synergistic effect that shortens treatment time. C. Increase the number of circulating neutrophils. D. Reverse drug toxicity and prevent tissue damage. Leucovorin is a form of folic acid used as a rescue therapy to protect healthy cells from the toxic effects of methotrexate and similar chemotherapeutic agents. Question 25. A 4-month-old is brought to the Well Baby Clinic for immunization. In addition to the DPT and polio vaccines, the baby should receive A. HIV titer. B. Mumps vaccine. C. Hepatitis B vaccine. D. MMR. The Haemophilus influenza type B, HIB, vaccine is routinely administered at 2, 4, and 6 months of age. Question 26. The physician has prescribed esomeprazole, Nexium, for a client with erosive gastritis. The nurse should administer the medication A. 30 minutes before meals. B. With each meal. C. In a single dose at bedtime. D. 30 minutes after meals. Nexium is a proton pump inhibitor, PPI, and is most effective when taken on an empty stomach, at least 30 to 60 minutes before a meal. Question 27. A client on the psychiatric unit is in an uncontrolled rage and is threatening other clients and staff. What is the appropriate action for the nurse to take? A. Call security for assistance and prepare to sedate the client. B. Tell the client to calm down and ask him if he would like to play cards. C. Tell the client that if he continues his behavior he will be punished. D. Leave the client alone until he calms down. Safety is the absolute priority. If a patient is a threat to others, security should be called for containment and medication administered for sedation. Question 28. When the nurse checks the fundus of a client on the first postpartum day, she notes that the fundus is firm, is at the level of the umbilicus, and is displaced to the right. The next action the nurse should take is to A. Check the client for bladder distension. B. Assess the blood pressure for hypotension. C. Determine whether an oxytocin drug was given. D. Check for the expulsion of small clots. A fundus that is displaced to the right and above the umbilicus is a classic sign of a full bladder. The bladder should be emptied and the fundus reassessed. Question 29. A client is admitted to the hospital with a temperature of 99.8 degrees Fahrenheit, complaints of blood-tinged hemoptysis, fatigue, and night sweats. The client's symptoms are consistent with a diagnosis of A. Pneumonia. B. Reaction to antiviral medication. C. Tuberculosis. D. Superinfection due to low CD4 count. Low-grade fever, night sweats, fatigue, and hemoptysis, coughing up blood, are the classic clinical manifestations of pulmonary tuberculosis. Question 30. The client is seen in the clinic for treatment of migraine headaches. The drug Imitrex, sumatriptan succinate, is prescribed for the client. Which of the following in the client's history should be reported to the doctor? A. Diabetes. B. Prinzmetal's angina. C. Cancer. D. Cluster headaches. Imitrex causes vasoconstriction and is contraindicated in patients with coronary artery disease or Prinzmetal's angina because it can trigger a myocardial infarction.